Welcome to another deep dive. This time we're tackling a case report, and it's a pretty technical one. So buckle up for a serious neurology deep dive.
Yeah, this case is a real head-scratcher. In a good way, of course. It takes us through the whole process of figuring out what's going on with a dog who's having some pretty unusual seizures. It's a great learning opportunity for anybody interested in vet neurology.
So let's jump right in. This case involves a 6-year-old female podenco-crossbreed dog.
Yeah.
And she was initially brought in because of these, as they call them, unusual seizures. What was unusual about them?
Well, she wasn't losing consciousness like you often see with seizures.
Right.
Instead, she was suddenly losing her balance. And the initial tests ruled out a lot of the usual suspect, like those infectious diseases you see with things like Babesia, Ehrlichia, Leishmania.
Okay.
They even ruled out a heart condition called convulsive syncope, which can sometimes look like seizures too.
Oh, interesting. So they did a pretty thorough workup right from the start.
Absolutely.
What did the initial blood work show? Anything significant?
There were a few minor things, like a slightly elevated serum albumin level, increased hemoglobin.
Okay.
And they also found a low serum thyroxine level, but that was easily corrected with medication.
Okay.
But none of those findings really pointed them in any specific direction at that point.
So even with the thyroxine corrected, the seizures still continued?
Yeah, unfortunately they did.
Hmm.
A few months later, she had another episode, actually a cluster of these seizures, and that's when they referred her to the University of Leipzig for some more specialized testing.
Makes sense. So at the university, what kind of investigations did they do?
They really went all out. They did an abdominal ultrasound, a complete neurological exam, and even checked for antibodies against Toxoplasma gondii and Neospora caninum.
Oh, wow. So parasites were on the radar, too.
Yeah, those parasites can sometimes cause neurological problems, but all of those tests came back normal.
So the mystery deepened even further. I'm guessing this is where the MRI comes in.
You got it. The MRI is where things started to get really interesting. The MRI showed some symmetrical hyperintensities
Okay.
in the lentiform nuclei and globus pallidus
Okay.
on both sides of the brain. And these hyperintensities, they were visible on all these different MRI sequences, both before and after they injected contrast dye.
Okay. So for those of us who don't spend all day looking at MRIs, can you break that down a bit? What do those findings actually tell us?
Sure. So basically, these hyperintensities are areas in the brain that show up brighter than usual on the MRI images. And the fact that they were symmetrical, meaning they were in the same spots on both sides of the brain and didn't change after the contrast dye, that really helped narrow down the possibilities.
Gotcha. So what were they thinking at that point in terms of possible diagnoses?
Well, based on the MRI, they had a few things on their list. Things like a portosystemic shunt, which is basically a blood vessel abnormality that can affect the brain,
Right.
possible intoxication, some metabolic disorders, and of course, autoimmune encephalitis.
So still a pretty wide range of possibilities at this stage. What was the next step in trying to figure out what was going on?
The next step was to analyze the cerebrospinal fluid, the CSF.
Okay.
And that initial CSF analysis showed a moderate increase in the number of lymphocytes.
Which are a type of white blood cell, right?
Exactly. They're a key part of the immune system.
Right.
And they also found a slightly elevated protein level in the CSF.
So that points to inflammation in the central nervous system.
Yeah, it definitely suggests that there's some sort of inflammatory process happening. However, the lymphocytes themselves, they had some unusual features that actually made them think about lymphoma.
Oh, okay. So now we've got lymphoma potentially in the mix, which is obviously a pretty serious concern.
Yeah, lymphoma can definitely affect the brain and spinal cord, so that was something they had to consider.
So what happened next? Did they start treatment for lymphoma?
They repeated the CSF analysis about 7 weeks later.
Okay.
And this time, they found an even higher number of lymphocytes.
Oh, wow.
So based on that, the team at Leipzig recommended starting treatment with prednisolone, which is a corticosteroid,
Okay.
and lomustine, which is a chemotherapy drug.
So a pretty aggressive approach.
It is, especially considering they weren't 100% sure about the diagnosis.
Right. They still hadn't ruled out lymphoma definitively. So what did the owners decide to do?
The owners decided to get a second opinion from another neurology specialist. They decided to go to Berlin to see another specialist.
Okay, makes sense. So what did that consultant find?
Well, they did another CSF tap, and the results were basically the same, still that increase in lymphocytes. Although the morphology was a little unusual, they noted.
Interesting. So did they do any further testing to try to narrow down the cause of this persistent inflammation?
Yeah, they did a bunch more tests on that CSF sample, like PCR testing to look for a whole range of different infectious agents.
Okay.
And all of those came back negative.
So still no clear answers. What do they do next to try and get to the bottom of this?
Well, they basically ruled out the most common causes, so they decided to look into the possibility of a rarer form of encephalitis.
Okay.
They sent the CSF sample to a specialized lab for, it's called an indirect immunofluorescence test
Okay.
on marine brain sections.
Marine brain sexes. So we're talking mouse brains?
Yeah, mouse brain tissue.
Okay. Now we're getting into some seriously technical stuff.
Yeah.
Can you walk us through what that test actually involves and what they're looking for?
Basically, they're looking for antibodies in the dog's CSF.
Okay.
That might be targeting specific parts of the brain. And to do that, they use these thin slices of mouse brain tissue that have been treated in a special way to preserve the structure. And then they incubate these slices with the dog's CSF. And if there are antibodies present, those antibodies will bind to whatever they're targeting in that brain tissue.
So if the dog's immune system is attacking its own brain, those antibodies would latch onto something specific in those mouse brain slices.
Exactly. And then here's the clever part. They use a second antibody that specifically binds to dog antibodies.
Oh, okay.
And this second antibody has a fluorescent tag attached to it.
So it's like a little beacon that lights up if those dog antibodies have found their target.
Yeah, that's a good way to put it. When they look at the brain slices under a special microscope that uses ultraviolet light, they can see those fluorescent tags light up.
That's fascinating. So what did they see when they looked at the brain slices from this dog?
Well, they saw something pretty striking. The dog's CSF contained antibodies, and these were strongly binding to the myelinated fiber tracts in those mouse brain sections.
Myelinated fiber tracts. So that's the myelin, the fatty substance that insulates nerve fibers.
Right, exactly. Myelin's super important for nerve function.
Okay, so now we're starting to zero in on a potential target, myelin. But how did they confirm that myelin was definitely what the dog's immune system was attacking?
So to be absolutely sure, they took it one step further.
Okay.
And they used brain sections from a special type of mouse called a shiverer mouse.
Shiverer mouse. What's so special about a shiverer mouse?
Well, shiverer mice have a genetic mutation that actually prevents them from producing a protein called myelin basic protein, MBP, which is a major component of myelin.
Right.
So they don't have MBP.
I see where this is going. So if they didn't see any antibody binding in the brain sections from those shiverer mice, it would mean that MBP was the specific target.
Precisely. And that's exactly what happened.
Okay.
When they tested the dog's CSF on the shiverer mouse brain sections, there was no antibody binding at all.
Wow, that's pretty conclusive, isn't it? So we've got a dog with unusual seizures and MRI showing these symmetrical abnormalities in the brain. And now we've confirmed that her immune system is making antibodies against myelin basic protein. It's really starting to sound like a case of autoimmune encephalitis, specifically one targeting MBP.
You're putting it all together very nicely. And here's where it gets really interesting. As far as the authors are aware, this was the first documented case of MBP autoantibody-positive encephalitis in a dog.
Wow. So this podenco-crossbreed is a pioneer in veterinary neurology. That's incredible.
It is, and it really highlights how much we still have to learn about these conditions in animals.
That's for sure.
Yeah.
What do we know about this condition in humans? Have they seen anything similar?
Yeah, actually they have. MBP, autoantibody-associated encephalitis, it's relatively newly recognized in humans too. But there was at least one case report of a human patient who was suspected of having multiple sclerosis, and they were found to have these high levels of MBP antibodies in their CSF.
Interesting.
And what's even more interesting is that this patient's symptoms actually improved with immunotherapy, and as their symptoms got better, their antibody levels went down.
Oh, wow. So that really suggests a strong link between those antibodies and the disease process.
It does. It suggests that those antibodies are actually playing a role in causing the neurological problems.
That's fascinating. So what are the implications of this canine case for how we might diagnose and treat similar conditions in other dogs, or even potentially in humans? Welcome back to the Deep Dive. We're continuing our discussion of MBP, autoantibodies-associated encephalitis in dogs, and we're thrilled to have a special guest with us for this segment, Dr. Guestname, a leading expert in veterinary neuroimmunology. Welcome to the show, Dr. Guestname.
Thanks for having me. It's great to be here.
We've already covered a lot of ground in this case, but we're really looking forward to hearing your expert perspective. So to kick things off, could you tell us a bit about your work in veterinary neuroimmunology? What drew you to this area of study?
Well, I've always been fascinated by the connection between the immune system and the nervous system.
Yeah.
And during vet school, I was just really intrigued by those cases where it seemed like the body was sort of attacking itself.
Right.
Leading to all these complex neurological issues.
Yeah, it's like a biological mystery trying to unravel why the immune system would turn against the very system it's supposed to be protecting.
Exactly. And as I got more into this field, I became particularly interested in autoantibody-mediated encephalitis, which is kind of a newer category of neurological disorders where the immune system is producing these antibodies that target specific parts of the brain and cause all sorts of problems.
And as we've been discussing, this case report suggests that MBP, myelin basic protein, might be one of those targets in dogs.
Mm-hmm.
So what are your thoughts on the significance of this finding?
Well, it's really intriguing because it kind of lines up with what we're seeing in human neuroimmunology.
Okay.
MBP has been on our radar for a long time with conditions like MS, multiple sclerosis, but its role in these autoantibody-mediated encephalitis has only become clear more recently.
Okay.
So the fact that we're now finding evidence of these MBP targeting antibodies in dogs suggests that maybe this condition is more common in animals than we thought.
So this case report could really open up a whole new area of research in veterinary neurology.
It could, definitely. It really highlights the need for more studies to figure out just how common this is.
Right, because if we don't know how often it occurs, we could be missing it in other dogs who are showing similar signs.
Exactly. And if we don't recognize it, we can't treat it properly.
That's a great point. Early diagnosis is so important, especially if you're thinking about using things like immunosuppressive therapy.
Absolutely. And that brings up another interesting point about this case. The owners decided not to pursue any medical treatment.
Right.
And the dog actually did okay for several years after that initial diagnosis.
Yeah, it's pretty remarkable.
Yeah.
So does this kind of challenge how we think about treatment for these conditions? Like how aggressively do we need to treat them?
It's a good question. And I think it's important to remember that every case is different. There's no one-size-fits-all approach when it comes to these complex conditions.
Mm-hmm.
And the decision to treat or not to treat, it's a very personal one that involves a lot of factors.
Yeah, I can imagine. Things like the dog's overall quality of life, potential side effects of medication, the owner's preferences, it all plays a role.
Absolutely. And in this particular case, it seems like the owners were very proactive in managing the dog's environment.
Good.
They were really careful about avoiding things that might trigger those seizures.
Right, so they focused more on minimizing stress and potential triggers.
Right. And while that's not the typical approach, it did seem to work for this dog.
Yeah, it's pretty amazing actually how resilient animals can be, especially with the right support.
It is.
But it also makes you wonder if that same approach would work for other dogs.
It does, and I think this case really highlights why it's so important to have good communication between vets and pet owners.
Absolutely.
Because those medical decisions, especially for these tough cases, they should be made together, considering the animal's best interests.
Absolutely. It's a team effort.
It is.
Speaking of, are there other studies that support what we're seeing in this case report?
Yeah, there's actually growing evidence that this autoantibody-mediated encephalitis might be more common than we originally thought.
Okay.
There have been a few studies, although they're small, but they have found these antibodies in dogs and cats with all sorts of neurological problems.
Can you give us some examples?
Sure. One study looked at dogs with neurological disorders, and they found that a small number of them actually had antibodies against the NMDA receptor in their CSF.
Okay.
And the NMDA receptor, that's a really common target in human cases of this type of encephalitis.
Interesting.
And 2 of the dogs in that study, they were poodles, and they had symptoms that looked like MUO, meningoencephalitis of unknown origin.
Right.
And based on the MRI and CSF findings, they fit the criteria for autoimmune encephalitis.
Wow. So even though it was a small study, it really lends some support to the idea that these autoantibodies could be playing a role in canine neurological diseases.
Exactly. And there have been other reports of autoantibodies in dogs with neurological problems, but we're still figuring out exactly what they all mean.
Well, this has been an incredible deep dive. What would you say is the main takeaway message for our listeners, especially those who might be facing similar challenges with their own dogs?
I think the biggest takeaway is that veterinary neurology is a field that's constantly evolving.
Right.
We're learning more and more about the brain and the immune system all the time.
Yeah.
And this new knowledge is giving us better tools to diagnose and treat these conditions in our patients.
That's definitely a message of hope for pet owners who are dealing with these really tough situations.
I hope so.
And for those who want to delve deeper into this topic, are there any resources you recommend?
Oh, there's a ton of great information online.
Okay.
I always recommend checking out reputable veterinary organizations like the American College of Veterinary Internal Medicine or the European College of Veterinary Neurology.
Okay, great.
Their websites usually have really good fact sheets and articles that are written for pet owners, and they explain these complex topics in a way that's easy to understand.
That's really helpful. And of course, talking to a board-certified veterinary neurologist is always the best way to get specific advice for your pet.
Absolutely. Early diagnosis and intervention can make a huge difference.
Well, Dr. Guestname, thank you so much for being with us today and sharing your expertise. This has been a truly fascinating conversation.
It's been my pleasure. It's always great to talk about this stuff.
And to our listeners, thank you for joining us on this deep dive into canine encephalitis. We hope you found it informative. From Vet NeuroJar, keep those minds inspired, hearts light, and tails wagging.